Good evening and thanks for joining us. Lots of developments to get to on this Thursday. We all long to lead with a story that's not related to this virus, but today is not that day. Today, the world reached a new milestone. More than 1 million people around the world are now confirmed to have COVID-19, and the number of confirmed cases in Canada is still rising steadily. More than 11,000 people in this country are known to have the virus, and more than 160 people have died. Nearly half of them were in long-term care and retirement homes. Quebec reported the biggest spike today, 907 new cases there. The number of infections is also rising everywhere. Those numbers do not include all the people who have not been tested yet or who are still waiting for test results. Many countries, including the US and the UK, have released infectious disease models they are using to plan for the impact of this virus. The models give projections of different scenarios, best case and worst case. Prime Minister Justin Trudeau says he knows Canadians want to see those numbers and predictions, and that, he said today, will happen soon. Ontario's Premier went a step further today. Doug Ford says he'll release Ontario's models tomorrow, and he says there'll be a wake-up call.
The situation is extremely, extremely serious. You deserve to see the same data that I see when I'm making decisions. You deserve to know what I know when you're making decisions for yourself, your family, and your community.
We don't need projections to know what's already happened in other countries. Canadian hospitals are preparing for a surge like we've seen in Italy, Spain, and the United States. Healthcare workers we know have been raising the alarm about shortages of personal protective equipment, masks, gloves, and gowns. Tonight, the Canadian Medical Association has a stark new picture of how badly that is all needed. The CMA surveyed 5,000 doctors this week. More than a third in offices and walk-in clinics say they'll run out of N95 masks, face shields, and goggles within 2 days or less. In some cases, they've already run out. Physicians in hospital settings aren't sure how long their supplies will last. Many say they're already being asked to ration supplies. Federal officials say more supplies are on the way and production in Canada is being ramped up. The health minister did admit the disease models, even the best case scenarios, show that our healthcare system will be overwhelmed.
Ultimately, at the end of the day, our health system cannot cope with the surge. It was never designed to see that many critical patients all at once, nor would any system around the world be designed, as we have seen from countries all around the world try to get ready for this surge.
Mercedes Stevenson is with me from Ottawa. Mercedes, getting personal protective equipment is a matter of life and death for doctors and nurses. What's the latest on what is coming and when it will arrive?
Well, Donna, help is on the way, but the question is whether it will make it to the front lines fast enough. These are the most recent stats that we have from the Government of Canada. I got them just before we went to air. So far, 10 million masks have arrived this week. Another 1.1 million arrived overnight. Those are all surgical masks, though, not the N95 kinds with the ventilator on them. Now, staff are going through these masks, I'm told, 24 hours a day to vet them and get them out. 174 ventilators have now gone out to the provinces, and there's more coming in. But to give you a sense of the overall numbers, Donna, there's 157 million surgical masks yet to come, 60.9 million of those N95s that haven't shown up yet, and about 4,000 ventilators. Now, doctors and nurses on the front lines are saying they need this desperately now. Take a listen to what the Canadian Medical Association had to say.
We really feel that we're at a crisis point, and it's causing physicians, nurses, and other healthcare workers on the front line immense anxiety and additional stress that they don't need right now.
Now, Donna, the federal government says that the provinces all have orders in as well. But on this call tonight with the premiers, this is one of the things they're going to be discussing, is who is in the most urgent need and starting to move those supplies as quickly as possible.
Okay, Mercedes, let's talk about the disease models. Ontario's Premier says he's going to release that province's disease models tomorrow. He says people deserve to see the same projections that he is seeing. The Prime Minister said last week the federal public health models would be released too, but they haven't been. Do we know why not?
Well, Donna, so far the Prime Minister says that they have concerns about accuracy and they're trying to make sure that the models reflect reality. Take a listen to what he said to reporters earlier today.
We're coordinating with the provinces to make sure that the data is consistent right across the country. And that is the numbers that we are putting through into various models. And as we get those models more accurate, we look forward to sharing them with Canadians.
The federal government is under increasing pressure to release their modeling. Part of that means they have to get the modeling from the provinces, all of whom have been doing this differently. But experts say releasing these models could help with behavior, Donna, if people see how bad things could get.
All right. Mercedes Stevenson in Ottawa, thanks. Jeff will continue to consult with experts and try to answer your questions. Send them to yourquestions@globalnews.ca. And on our website, you'll find a special page dedicated entirely to COVID-19. That's at globalnews.ca/coronavirus.